Welcome back, my friends, to the show that never ends.
Welcome to the show that never ends. Sexual Healing Podcast. Conversations will address concerns and celebrations within the misunderstood and misinformed world of sexual being. Your hosts, Dr. Bill, Mac, and Pipes, bring insight from different sexual health perspectives, covering 70 years of experience.
70 years of experience? Holy crap, I didn't realize I was that old. Thanks, guys. This is Dr. Bill with Sexual Healing Podcast. We're with our co-hosts, Mac and Pipes. Thank you for listening, tuning in. This is what I want to know today. I want to talk about sexual dysfunction in men. You guys tuned in last week, I hope, and we covered female issues. Let's figure out for the next gender. And I've been out of it for a while. I've been working pretty hard at my office. Has there been another gender other than the male and female? Although there's a lot of things socially occurring, but we're still just talking about two genders, right? Okay, because that
we're sticking straight on penis and vagina.
Penis and vagina. Okay,
penis and vagina.
Very good. I can work with that. So thanks our co-hosts. Thank you our production team. We've got Jose, Shelby, our support staff, Cody, making it safe for us to broadcast, educate, and entertain. We thank you guys for tuning in. Remember, please remember, look us up on your favorite podcast platform, Sexual Healing Podcast. We're here to educate and entertain. Thank you. Guys, let's talk about sexual dysfunction in men. Unfortunately, as we covered last week, that seems to be the predominant issue when we do talk about sexual health. It's been focused for as long as I can remember on male sexual health. It's only been the last couple decades where we've opened our eyes and we've realized that, hey, maybe someone else should be, some other gender should be looking at. Certainly, when I was in high school and most of college, sexual dysfunction just related to me. I wasn't involved with any partner. So now that I'm a little older and have a fair amount of money, I had an opportunity to expand my horizons. Is that even funny? Am I going to get in trouble? Am I okay? All right. So guys, Pipes, Mac, when we talk about sexual dysfunction in men, what do we need to know? Mac, help me out here.
Well, we know what we don't know, and that is we don't know a lot about it as far as what if we were to listen to advertisements on television and maybe some stuff on the internet, because a lot of people are just trying to sell a product. You may have an incident where you're like, oh, last night I just couldn't get it up, and you go, oh, I'm losing it, and they'll go off and try to buy something. But it's real though. Don't let me discount the fact that male sexual dysfunction is real, and it could be caused by many reasons. It could be even over-the-counter medications, antihistamines. It's physical if you have underlying health conditions, psychological if you're suffering from type of depression. It's all intertwined, and it's all about mental health and sexual health. They're connected, but it is real. And the great thing is there are treatments out there. We talked about the women last week. Not as many. I would say there's treatments out there, but not as many invasive treatments or really, I don't know the right word I'm looking for. Just
make it up. No one's listening. Just fake it.
Just fake it, huh? To make it. Go ahead.
There's a longer process. There's a longer process for men for sexual dysfunction, and I'm kind of leaning into the erectile dysfunction because that's really our history and our background.
Our personal history.
Yours and mine.
I wasn't going to bring it up, but as long as we can do a Howard Stern here, if you guys want to talk about it, that's fine.
Open the kimono.
Yeah,
there
right,
we go.
Right.
No, but there's a process for the sake of argument for erectile dysfunction. You start with the little blue pill, and then you can do injection therapy, and you can do testosterone, and then you can go to an implant. With female sexual dysfunction, it's not as broad as male sexual dysfunction is. And so I think on the male side, you've got the the Romans and the hymns, and you've got all of these companies that are spending a lot of money to talk about sexual dysfunction. And that isn't it's absolutely not the same on the female side. So male sexual dysfunction has a place kind of like in the normal world, and people are a little bit more aware. They're not aware of everything that it entails, and they're not aware of what their options are to move forward. Hence the reason you need to go find an expert, and you need to talk to people who understand this. Primary care physicians, obviously your first line of defense, and you go and you have your conversation with them. But ultimately, there are experts out there that can help you. Urologists like Dr. Bill, who really, really focuses on this. Sex therapists, psychiatrists, as you discussed earlier. Mac, this is about mental health as well as the physical aspect. So it's a large umbrella, and what we're trying to do here right now is just discuss the factors under the umbrella.
Well, it's very interesting. As I was listening to both of you and quietly and comfortably undressing both of you with my eyes in my mind, I was
remember, I'm a podcast eye candy, so remember that.
That was the term I was looking for.
And I'm just here for my mind. Just for my mind.
No, but it's hard to fake for men. I think one of the reasons that we historically focused on men, it's hard for men to fake an erection, right? It's hard for men to fake ejaculation. When we talk about women, it's pretty easy. And in fact, I should write a book about all the women I've dated and how they've individually cornered the market on faking any kind of positive sexual response. But that being said, maybe that's why men have really been in the spotlight about treating sexual function. And you mentioned, Pipes, you mentioned a lot of the internet opportunities for treatment, WebMD and Ronan, all the other guys that have variations on the theme that have done very well, but they're treating erection issues. They're treating a soft penis. They're not addressing other things. And in fact, what do you guys see as the most common reason why patients come to the urologist for sexual dysfunction? What's the number one complaint?
Well, first of all, you should be answering that since you're the urologist. But I will say it is
premature ejaculation.
Yeah.
Premature ejaculation is number one.
You think that's it?
Yes.
Well, you answered that
30% of men are suffering from it at all ages, whereas we know that erectile dysfunction, it's related to age. You get older, it's going to fall away, or if you're on some type of medication, other issues as well. But if we're perfectly healthy, the older we get, the higher incidence of erectile dysfunction. But PE, premature ejaculation, it happens from 18 all the way up. So I would say that's number one. That's my guess.
And both Pipes and I applaud you for your honesty and your disclosure, Mac, because you're absolutely correct. And
sharing your story with us.
Sharing your story. And
since I was 18,
we welcome you, heel, and I'm going to touch you on the forehead. Only once. That's all I need to make you ejaculate because it's premature. But I'm pumped. But
okay, time out.
Oh, too religious? Too soon? All right. So here's the deal. It's too close to Yom Kippur and Rosh Hashanah, so I'm not okay. I retract that. But you're right. It's closer to about 40%, at least in my practice, of people that come to see me are experiencing premature ejaculation. None of the advertisements that we talk about the little blue pill are talking about that. They're not addressing it because there's no money in it. And there's several treatments, including behavior modification, including $2 a gallon of desensitization cream, including a discussion with your partner and communicating, including communication on what feels good, what doesn't, and making things better. It's in your control. There's no money in it, unfortunately, for big pharma. So the, premature ejaculation is probably it is the number one complaint. And then you talk about the other things: erectile dysfunction, Peyronie's plaque, or what's the banana thing that we've talked about, curvature, painful erections, scarring, or curvature of erections, all those kinds of things.
Different disease states, cardiovascular disease, diabetes. I mean, sexual dysfunction is, again, as I said earlier, it's such a big umbrella. Well, and we are hitting on like small portions of this because people just don't understand. Again, our whole point is to educate and have very candid conversations, which is what we're doing, because people don't understand. They shouldn't feel like they're the exception, because it's almost more the norm that there may be some level of sexual dysfunction in your world, be it premature ejaculation, be it, the fact that you can't have an erection, or the fact that you can get an erection but you can't keep an erection. I mean, so many aspects. And this is why we're here, is to make sure that people understand, like, these are conversations to have, because there's ways to treat this.
And remember, sexual function and mental health are intertwined. If you have an issue with sexual function, you're going to feel less desirable. You're going to feel a little depression set in. Everything, and it affects it. So the importance and people are not embracing sexual health as a disease state like mental health and physical health and stuff. It's real. And that's why I think we're really here, because I think we get more people smiling out there, then we're going to be a better society. And please, sexual function, it's real. Mental health, it is connected, and we need to be on the watch out for both.
So Mac brings up a huge point: is that not only erectile dysfunction, the inability to have a good, strong, hard penis for penetration, but 35-40% of us over 40 have low testosterone. And it's not only the sexual health issue, but people with low testosterone clearly are depressed. There is a physical manifestation. There's a reproducible depression that can be reversed based on people who have low testosterone, and we supplement that depression melts away. We know that testosterone, it's not the guys who look like me who are tremendously handsome, buffed bodybuilders. Why you guys, is there someone laughing? Get security. Security! Cody, get on that guy. No, the point is that testosterone is a deficiency is a very real deal. It's not just for weightlifters. It's not just guys who want to look good. It's not good. It's not just for guys who want to have more energy. And it's not just for guys who want to have better sex. And all of that within reason, if they fall into that category where their testosterone is low, all of that is real. But pain management is improved with testosterone. Bone strength, osteoporosis is improved with people who have testosterone supplement who are low. Depression, mental acuity, memory, all of those things are very real. So it speaks to what Pipes has alluded to and Mac has alluded to, is that, yeah, if I have problems with erections, even if I'm a premature ejaculator, even if I'm not interested in sexual health, it's not just about what's going on in the bedroom. It's not just about bragging rights at the bar on the weekends. It may be an indicator of what? Cardiovascular disease. Remember, the vessels in the penis, except for you, Mac, because you're almost 7 feet tall, the vessels in the penis are very small relative to the vessels in the neck that feed the brain, or that go to the kidney, or that go to the heart. So if we have a guy who's 50, who's otherwise healthy, not a smoker or a drinker, that who put that in my hand? Okay, that there may be an underlying problem, and let's see, Pipes is pointing out that it can be with females as well if they're drinkers. But my point is that it's not just an ego issue. It is an indicator of other issues, and it's so important that we get this addressed. How do we get it addressed? Why is there this stigma about sexual dysfunction in men?
We're addressing it right now. Sorry, I didn't mean to stop. We're addressing it right now. That's why we're here.
Oh, I forgot.
This
Thank you.
is the
for
reason,
reminding me.
that we've all come together is because we know how important this is, and we know how prevalent it is, and on so many different levels. And for us to be able to have this conversation and say, you know what, this is where we're at, or I mean, this is the reality of the world. Let's have some of these conversations. And you know what? Let's get you to the person. Let's get you in front of the expert that is ultimately going to help you. Because there are so many opportunities to help.
So what's our summary, Matt? Go ahead, summarize for us.
I would say, first of all, don't wait for it to get better, because it's not going to get better. It's a physical issue. It can be a psychological issue on a smaller scale, but don't wait for it to get better. Go see if you need your primary care, but insist on seeing a specialist. Every community has a specialist. If not, find Dr. Bill. He'll take care of you. But it's something that cannot be taken lightly. We need to talk about it with our partners. We need to talk about it with even our friends. I was in a conversation with some buddies, and we're all, high on testosterone, think it doesn't affect us. And I told them, look, at 50 years old, 50% of men have some type of sexual dysfunction. And at 60, 60%, and it gets gradually bigger. So don't put it off for yourself, for your partner. Get it addressed. Well, reach out to us. We'll help you out.
Thank you.
Yeah. Any questions?
And that's a good point.
Send them to us.
Let me ask you something, Pipes. You mentioned we should all come together. And maybe that's another podcast, but is it that important for couples to come together? Were you talking about that, or were you talking about this discussion?
Well, no, for sure. Couples need to learn how to have it's a difficult conversation to have, but couples need to know that this is not, you're not alone. Have the conversation with us, and then invite your partner to watch this. And so they understand what you're going through. And maybe you don't have to have the conversation. We'll have the conversation for you. Well,
both of you, thank you for making me sound less of a dick with my questioning. And
we're all good.
Professionalizing my question. I thank you guys for listening. I thank Mac and Pipes, my team, Shelby, Jose, and Cody. Remember what Pipes has just said. Call us. Talk to us. Contact us on your favorite social media platform. We'll see you guys next week. Thanks for viewing. Thanks for listening. What is it? Sexual what?
Sexualpodcast.orgasm.
Thank you very much.
Sexual healing podcast.
Yeah.
You two are useless.
Hey.
I've heard this before. I heard that prom night.
I know.
Heal.
Right?
All right. Good night, guys. Thank you. We'll see you next week.
That hurt. Thank you all.
Welcome back, my friends, to the show that never ends.
Thank you for joining the show that never ends. We will pause with our part. However, you can reach us at sexualhealingpodcast.org. We are here to make your sexual health be everything you want it to be. We'll visit with you next week for another episode of Sexual Healing Podcast. Stay sexy out there.